Being at the center of the action, hospital physicians and staff must confront every situation and every challenge. They must also keep up with evolving health needs and knowledge through ongoing comprehensive training programs. What they need is a promising solution to ensure a continuous learning journey.
In today's world, technology is transforming life. Be it taxis, food delivery, everything we need is at our fingertips. Education is also going through a transformation, and we are at the forefront in the healthcare industry with IPC Health.
IPC Health is a comprehensive learning, training and skill development platform developed by Impelsys in India for healthcare professionals to attain the right mix of content, learning and skills that help them throughout their career. The platform offers a wide variety of courses that enable hospitals to meet their employee training and development needs in areas of quality compliance, soft skills and induction. The platform is designed in a way that it enables easy tracking of the real-time status of their learning progress. What's unique about this platform is that it's accessible anytime, anywhere, ensuring quality learning literally at your fingertips. Hospitals can now assign courses and track the competencies of users on specific topics with IPC's intelligent assessment tool, which gives them better administrative control. Its superior courseware helps hospitals provide standardized care and bridge skill gaps at every level in the organization. The healthcare professionals will also become more efficient and empowered when their learning journey progresses with ease and at their convenience.
IPC Health, your learning partner. Let us come together to improve the quality of healthcare in India by spreading knowledge through technology and making IPC Health your learning partner.
Thank you, everyone. Over to you, Steph.
Thank you, Risha. Let me just share my screen. Good. Welcome all to this knowledge sharing session. Very engaging agenda we have lined up today on a topic I know will be of high interest to you and also close to your domain and work environment. I'm Stefan. I'm the Commercial Relationship Director for RCNi at Impelsys and have worked closely with them over a number of years. RCNi is part of the Royal College Nursing Group, delivering that important access to peer-reviewed content and learning and development resources, and being that life learning, partner to nurses and healthcare workers. So you can see from the agenda, we have various segments covering key topics today by Mr. Phil Smithers and Dr. Richard Hatchett of the RCNi to discuss that global strategy and plans of the program in India and how learnings on how RCNi has helped nurses in their career progression. We've also got Lizzie John of Rcni Medical College. We'll talk about their evolving learning landscape and digital adaptation in nursing, and Mr. Deepak Sharma, CEO of IPC Health, on the challenges in nursing education and how RCNi CPD program can really help that, make that positive impact for nursing and nurses and healthcare workers. But first, let us start with an opening introduction to RCNi and IPC Health with Mr. Samir Sharif, CEO and founder of Impelsys, and key driving force for Impelsys' vision and purpose of spreading knowledge through technology and leading the way in terms of innovation and way forwards. So I think without further ado, Samir, if I could hand over to you, and it would be great to take us forwards.
Great, Steph, let me, great. Welcome everyone. Thank you very much. I'm very, very excited for this launch event. I want to basically start. I'm not going to have too many slides, but I have one picture that I want to actually share with everyone. So here is the picture. They say all great ideas come from, connections, and it's unfortunate that We haven't traveled much over the last year and a half because of the COVID pandemic. But this picture with the managing director of RCNi, Rachel, who's right in the center, was taken two plus years ago on January 29th of 2019. At this lunch, beautiful lunch that we had in London, we talked and pitched the idea of actually providing the RCNi CPD courses, actually morphing it and localizing it for India and actually delivering it to the Indian nurses. This was even before IPC Health. And they loved the idea and we started working. That was 2 years ago. Today, we're really, really honored to have this great day where we can actually launch this CPD program with RCNi. What's really important in our partnership with RCNi is the trust that we've actually built over the last several years. It all started in 2015 when the Royal College of Nursing actually needed a learning platform partner. There was an RFP, and that RFP was actually given out, and it was a competitive bid, and we were honored to win that RFP, and we built the RCNi Learning platform 6 years back. And that started our journey with the Royal College of Nursing. And then a couple of years later, they also wanted to build some great decision support tools for nurses to deliver better tools for the point of care delivery. And we built the decision support tool for RCNi. So we've become a strategic technology partner over the last several years, all on the basis of trust. So, we are now today launching the RCNi CPD program. There's a lot that we want to do over the next several years. Phil is going to talk about their strategy, the strategies that they've done in the UK, but also globally what they want to do. And we're really honored to be their partner in actually executing on those strategies. I also want to talk about IPC Health. It's been a little over a year since we launched IPC Health, and we're overwhelmed by the response in the healthcare market in India. Over 125 hospitals have actually signed up. Over 25,000 medical professionals are using it day in, day out to learn. And, so it's something that we have envisioned to really make an impact. And I think what's really, really important for us, in similarly, the trust that RCNi has actually given us to execute, to deliver great content and products for them. We want to build our relationships and trust with each one of you. Nursing is a great, the biggest backbone for healthcare in India. And Deepak will talk about how we are going to support you in your learning career, in your learning and development, and as you progress through your career. IPC Health is really the platform in this digital transformation that's happening in healthcare in India. And we're really excited about where it's going. Today, we're launching the RCNi platform. When we launched IPC Health a little over a year ago, we only had a few features. As the market told us what they wanted, we added more and more features. And we're really excited. This is just the beginning, what I call day one of IPC Health. You're going to see a lot of innovation over the next year and multiple years. And we really want to make an impact to really, spread knowledge through technology and deliver better care for everyone in India. So today, now I'm going to, hand this over to Deepak to continue and talk a little bit more about nursing and the challenges of continuing education in nursing, as well as give you more details of the CPD program that we are launching today. Deepak, over to you. I'm going to just stop sharing.
Hi, can you see me? Could you start my video?
We can hear you.
Yeah, I think my video is stopped, so I'll just try screen sharing. Just a moment.
Okay. We can't see you though.
Sorry?
We want to see your beautiful face.
Yeah, because my, my video is stopped. Okay, just one moment.
Richard, okay, we can see you. Great.
Hi.
Go ahead.
Hey, good afternoon and welcome everybody. Thank you for taking the time today. Thank you also for being the heroes every day for the last year or so. Everybody who's on this webinar, they put on the uniform and the PPE and they've been serving selflessly every day. And most of us were even afraid to step out of our homes, right? So the world is learning that we just can't do without you. And it's been a very demanding year for all of us, but it's been so much more challenging for all of you on the other side. So thank you once again. Right. But as we overcome this battle, we see that the future has a lot of promise and potential. And what I want to set the background here very quickly today for the exciting launch that we have planned with RCNi today is where the Indian nursing sector is and where it's evolved. I see it less as a challenge, but more as a potential. Not just in India, but everywhere in developed countries all over the world, the populations are aging, disease burdens are changing. The government is investing a lot more in the infrastructure, healthcare, and the quality of healthcare services, right? In last month's budget in India alone, there was nearly 58,000 crores additionally allocated to healthcare spending for more insurance coverage, more facilities, and better quality of coverage, right? The private sector is also investing in modern tools and technologies, in quality, in accreditation, in NABH. The fact of the matter is that there are just not enough doctors to serve our population in India. And many of the new avenues of growth have been recognized, like nurse practitioners, nursing leaders. These are now officially have been allowed in India and they will take off very quickly. So many of our talented nursing colleagues will be able to utilize their knowledge and experience to serve in much higher capacity than today. So whether it's practitioners or specialized or leadership roles in hospitals, the future of nursing jobs is a lot more rewarding, but it's also a lot more demanding, right? Why do I say that? This is what nursing jobs will demand in the future, because these will not be the nursing jobs of yesterday, right? This is what we'll need to prepare ourselves for, from managerial decision making to developing new clinical skills, to managing your own, organization, managing initiatives like quality, managing soft skills, managing your own career and your own self, and a lot more of technology as day-to-day users, right? In one sense, there's been a silver lining the last 1 year. The technology adoption has taken off much faster. Things like teleconsultation, etc., which were seen 5 years later, are now really almost normally accepted now. It's not just in India, all over the world. Things like using apps for a lot of medical processes is now almost commonly accepted, right? But the interesting part is that the digital healthcare training and learning is also catching up, right? This is a view of one of the webinars during the last 1 year. I don't know, maybe some of you are in that picture. It's been so heartening to see such a rapid adoption of our platform. We are now more than 125 hospitals, 28,000 health professionals, and hospitals are using it as an integral part of their staff development plans. Yeah. So, we are using them for quality training, we're using for induction, soft skills, webinars like this one within a hospital, training administration, even recruitment, right? So healthcare training and learning and talent management is really seen a quantum leap in the last 1 year that we've been in the market. And this actually sets the stage for the next big step in our journey, that is to prepare you for the nursing roles of the future, right? Which is the RCNi CPD program that we're launching today. Now, this has been customized for the Indian segment in the sense that there's a lot of updated statistics and research from India and local guidelines wherever relevant. There's also a lot of first-time content, which is from a nursing perspective. So a lot of this is relevant for the Indian segment. It just hasn't been available, or it has been available from a doctor's perspective, right? So there are broad categories like clinical care, infection control, patient-centered care, case management, etc. And within clinical care, you have very specialized courses like catheter-associated UTI, stoma care, ventilator-associated pneumonia, pressure ulcers, and there's a lot more, right? The biggest part is all being delivered, adapted to a certain extent for the Indian market, and also the first time something like this is available from a nursing perspective. Okay. Our goals are to promote lifelong learning, and we want this to be a constant companion. It bridge the gap between nursing education and practice, between global and local. Keep it as a ready reference material and a personal resource for both students and professionals to use it on their professional journey. using the best technology we've developed. As Samir may have mentioned, we've been working in medical education and training for the last 20 years. A lot of the very well-designed adult learning technologies have been deployed on IPC Health platform, which are also going to be used for the RCNi product. We've also designed the product so it's, it starts with a great body of content. It's continuously refreshed. It's just like having your Netflix subscription where you can look forward to on ongoing learning. It can be continuously both your reference material and your go-to for refreshing your knowledge and skills. And to top it all, the certificate that you get accredited is at the end of the course is accredited by the Royal College of Nursing. This is what it looks like. Now I'll take a deep dive into the product to show you the walkthrough on how do you navigate, how do you use the product. But here's a few, there are two segments that the product's currently targeted at. One is for nursing educators in hospitals. So this is a B2B model where nursing educators and training leaders in hospitals will be able to use the product very flexibly. So there's a corpus of courses across these topics, which can be customized into modules based on the needs of different cohorts of the nursing staff. So junior nurses can you can develop induction and other basic courses for junior nurses, and based on the development needs or the performance-based inputs, you can assign courses to them. And also for senior nurses, you can schedule ongoing professional updates in specialized areas where required. The other segment that this product's meaningful for is nursing professionals, which is individual students or nursing professionals who sign up for themselves. So I think this is in context of what I talked about a while back in terms of evolving landscape of nursing. I think this will help them develop broad exposure to different domains, explore different areas of specialization, and really excel in patient-centric care, which is really becoming at the heart of nursing. Also, what it does is keeps you in touch with the evolving global best practices. Now, I will start with a quick walkthrough of the product, which is from the B2 side. If you're an individual consumer, and this has really been designed to be as easy, as seamless as any other e-commerce site you might be using, like an Amazon, to order things. And this is the entire process flow has taken a lot of feedback from some of you. I think we've had focus groups with a lot of people who are already on IPC Healthcare, and the entire experience is designed to be completely seamless. So if you're a first-time user, you click here on the login and you register and sort of start the process. As you enter your details here for the first time again to create your account, any other e-commerce site that you may be comfortable using, you'll find this almost as easy as anything else. In terms of actually discovering the RCNi specific content, there's actually 3 different ways you can discover content. On the store, to choose the RCNi product from the store, from the banner itself, you can browse. And also you can browse by selecting the specific category of RCNi. Again, the checkout process is 3 or 4 steps, which is almost very familiar to anybody who uses e-commerce sites. Here you can explore the product basic details. You can have subscription and access details. You can add the product to cart for the next step, which is prepares you for checkout. For the checkout option is again, you'll be very familiar with this kind of a checkout option. You just add this and you click to checkout. The billing address details are entered here. The product purchase details, again, the method of payment, etc., is a standard and intuitive way of entering this. Once you have purchased the product, this is what you get to see. Now, this is how it appears in your shelf as a product that you've subscribed to. You can look at the overview and actually start using the product, right? So the product comprises of, for B2C learners, it comprises of, lots of courses. I think they're already around 30 to start with, and we'll be adding more every month, right? The product certification, so the certification eligibility gets completed once you have completed 30 courses. And here you can easily track your progress. You can view the courses that you've completed. You can also launch individual courses within the 30, and you can click on the course title to view the details. To see progress, again, in individual courses, the number of attempts you made, your pre-test score, post-test score, to be able to go back and review the course if you need to, All of this navigation is very simple and intuitive at an individual course level. And this is what your final certificate would look like once you complete your 30 courses. Similarly, to enable seamless access for hospitals who want to buy this in bulk for their staff and employees, the store will be enabled for all hospitals, and this will be placed next to the home tab on their IPC Health portal. Users can explore the catalog and contact their learning admin. So if you're a nurse working in an IPC Health network hospital, you can contact your learning admin once you see products of interest to you. The learning admins can in turn request us via mail or phone and subscribe your hospital to it. Once the subscription is complete, we will automatically provision all the users with the respective content in the backend. And then the journey for actual, navigating the product, for learning, for taking the assessments, etc., will be very similar to what I've just shown you in the B2C segment. Okay. Now, I think Samir did talk about this initially, but what I want to emphasize before I go away is that this is just the beginning of the journey and just the first step. Just like we've leveraged relationship with RCNi to bring this for the Indian nursing segment, we want to continue leveraging our relationship with everybody on the platform. That means you. We want to build on the trust we've created. We'll be super responsive to whatever you tell us in terms of the product usability, features, content, etc., and reacting as true partners. And your feedback on an ongoing basis is super invaluable to make us really better and keep improving. So with that, I think we have questions at the end, but just one more. I think, yeah, so I'm done. So let me then hand over to Sister Lizzie John. Sister Lizzie John is a nursing superintendent at Maya Medical College Hospital. She has a vast experience, 24 years in nursing clinical service, education sector, and nursing administration. She received the Florence Nightingale Award during the National Nurses Day celebration during the year 2027. Over to you, Sister Lizzie.
Hello.
Hi.
Yeah. Thank you, Deepak. Thank you for that introduction. We are going to, I'm also excited to be a part of this launch of RCNi program. Yeah, today I'm going to speak on how exactly learning is getting evolved and how as a nurse, we have to adapt to the digital learning as the technology is improving every day. Today's kids are born digital. No, they are born into a media-rich networked world. So we have to be very well equipped. This is Florence Nightingale who says that, let us never consider ourselves as finished nurses. We must be learning all our lives. Our life, it is a lifelong learning. It can never, age is not a bar, or any other criteria will never come on a way of learning. But we need to every day, as the learning has been evolving, we have to adapt to that. This is very, very necessary because we as nurses are the frontline workers and we have a greater responsibility to update, keep ourselves updated as the technology improves. Now, why do we need nursing education? It's very clear that unless we update ourselves, unless we are in par with the digital technology, that does not help us in keep up on pace with the growing population or with the growing team of work. So this nursing nursing education helps us to it promotes critical thinking. It helps us to think better. It is not just a mechanical work, but critical thinking. And also researchers have shown that higher the education, better the patient outcomes. So as you climb the ladder of your education, definitely there will be a lot of better patient outcomes and the patients will be benefited. And also it improves your communication skill because as you communicate, as you have a lot of networks that you have, it helps us to improve your communication also. And this also gives a venue for networking with all other professionals. Like this webinar, how you come in contact with the other persons, the better you do your nursing education, the better you go up the ladder, then you have a better networking. mark my words, a day will come that your license will never be renewed unless you have the required credit points in your account as part of the continuing nursing education. So it becomes a very mandatory aspect as a nurse. Okay, then it also helps in your professional. Definitely, that sense of professionalism develops only when you are on a continuous education. So that is why nursing education is very, very important. Now we see that there is a traditional method of how learning was and how it has been evolved to a digital technology. So today, as you see, we have this scenario of COVID situation, pandemic we are going through. In case if we did not have this digital technology, definitely we would have been in a level where we would not be able to network or communicate with anybody else. Initially, it started with a chalkboard, a blackboard with a chalk. It says that it is like a sage on a stage, but it is no more like that. Today we have a guide on our side. Okay, then it later moved to the whiteboard, then later charts, and the hassles that we had with overhead projectors, preparing it, and imagine the current goes off and you're not able to move forward. But all that we have, it has evolved to a greater extent. But now we can think about video conferencing, tabs at your fingertips. You can use your mobiles, you can use internet for various e-learning. All this is the digital technology that has come into the market, that we need to keep ourselves updated, because in case if we are not updated with that, we fall short of the professional growth that we have. So definitely digital technology is moving at a greater speed, but we need to adapt to it. Digital technology has also got a lot of advantages. For example, in a hospital scenario, it improves the accessibility. Even the healthcare worker also, for example, the electronic health records, that helps us to have a better easy accessible to the patient's reports, patient's history. All the data have been stored in the electronic health records. So we do not have that difficulty of retrieving the file manually, writing it down. Everything is made digitalized. So it helps the patients also. They also will come to know what are their reports that of your reports. Everything they will be able to know. Telehealth has also helped nursing in the remote area where geographically they are away from the city, where nursing care is required. Telehealth has really helped in improving the nursing care also. Humans always make error. There are all chances errors to occur, but then technology has helped us to decrease the human errors. For example, cardiac monitors, infusion pumps, syringe pumps, all this helps us to, and even electronic medication administration, system of barcoding, it prevents, in case if there is any error that can occur in identifying the patient. Those errors can be avoided, because they, as you consider, nurses are as they are the frontline workers, they also have a family that they have to balance. So they, they have a lot of stress with them. There are chances errors can occur. But then if it has been digitalized, all these errors can be avoided and made the life of a healthcare worker much easier than manually doing it and causing unnecessary stress. The other advantages are the virtual reality simulations. You cannot try out everything on a human being, but these virtual reality simulations helps us to create a situations where you can develop your skills and build confidence and prepare for clinical practice. You have the real world clinical setting in case of a virtual reality simulations, and even simulation based clinical education also. That also is very helpful for, especially for the nursing students, to have real life situation experience without compromising the patient's well-being. So definitely what I mean to say is technology is improving day by day. It is evolving, learning is evolving, but we need to adapt to it, because we have a lot of advantages of having digital technologies. So we have to, it is not only that, even in India, if you see, the government is also taking a lot of initiatives of making it national digital health mission. If we see, even, it has been changes, the way we sell our goods, the way we procure our groceries. You need not carry money. Everything is digital. Everything is made so easy. And even the government is making initiatives to make sure that everybody has got a health ID, a digi doctor, health facility registry. All these are the initiatives which are taken by the government. So we as nurses should keep ourselves updated. And not only that, the Indian Nursing Council also has sent a notification that was in the year 2020 itself, that every nurse should have the continuing nursing education credit programs. So all registered nurse and registered midwives personnel must participate in a professional continuing nursing education program and earn 30 CNE credits or 150 CNE hours for every 5 years. Because initially, I always remember when I had done my registration, it was a lifelong registration. It is no more like that. Every 5 years, they are renewing the registrations. So when you go for your registrations, it is very mandatory that they will ask you, what are the continuing nursing educations that you have undergone? They need to have the document of what you have done. Believe me, the next few years, it will become every year, because the time that I have worked abroad, every year there is renewal of license. So if I have to obtain that license, I have to go through the mandatory classes that have been conducted, and I have to get that certificate. So definitely, I hope that whatever continuing nursing educations that you are attending will be of use, will become very mandatory for us even to get our license renewed. So it is very important that we have stepped into this era of e-learning. Let us make sure that all the educational institutions have become now mandatory in this pandemic, in this COVID-19 situations. Even in the hospital where I am working, because of the COVID pandemic, the trainers were also unable to, because of social distancing and because of the transmission of the diseases, they were also kept away. They were not able to train our nurses. But what we used was the IPC health modules that were there, which was very helpful for the nurses, so that they could go through these modules. And I'm sure that such e-learning will definitely help us, because this e-learning has created a footprint on the education system. It has really helped all our nurses to keep on par with the continuing education. So definitely IPC Health is a learning partner. It has really helped us, this digital platform, especially through the mobile app. So it is not necessary. It has taken off the offline classroom classes, which we were unable to do during the COVID time. So these nurses could access to these modules wherever they are, even after their COVID duties, during their quarantine times, and at the right time when we had COVID pandemic situations, the IPC Health pitched in with their mobile app, because every individual has got a mobile, be it a nurse, housekeeping, or anybody. They have they have a smartphone with them. So with that, they were able to achieve this, or able to go through these modules. And an added feather to the cap of IPC Health is the collaboration with RCNi. RCNi is the Royal College of Nursing. So they have collaborated with them, and I have gone through these modules. And definitely, even though if we were not able to make it to the Royal College of Nursing, those modules are there that will really help us out, because these modules are very organized and effective, and they give lot of, as already Deepak has shared with you all, they have lot of certified courses, and I'm sure these are going to be mandatory for obtaining the licensures, and it is deemed to promote the best practice. So definitely all the best practice, what is being standardized and what has been practiced worldwide, we will be able to practice it, and that can bring about effective education outcomes and improve the patient care. So RCNi Learning will help improve patient outcomes also and safety by enabling the staff to have immediate access to the best practices and resources to support continuing professional development. So I am really excited about this launch of RCNi, because definitely this is going to help the nursing students and all the nurses, because it's very handy. You can use it in your mobile also, and you can get all this done, because this is the best way of doing it. Thank you. Thank you for your patient listening. Over to Steph.
Thank you so much, Sister Lizzie. There were some fantastic discussion points there. I mean, I really resonate so well with what you said on the, the mandatory revalidation, really, in some aspects that's coming, and CPD will really play a really significant factor in that. And obviously for personal development aspects, but also from a point of view of patient safety, some really nice points there. Okay, just also to mention, we're kind of like over halfway through of this webinar event, and questions and answers, please do stream them through on the chat box. We will do the question and answer segment at the end of the sessions, because then we can kind of collect them together, give you guys a chance to think of some questions. Right, so for our next speaker, it gives me great pleasure to introduce Mr. Phil Smithers, Commercial Director of the RCNi. I've worked with Phil for many years, and he's been with RCNi for 5 years now. Prior to joining the RCNi, he's also worked in medical and nursing content publishing, so really responsible for the global sales and market operations, and hence has traveled extensively around the world and has a real wealth of experience when it comes to setting up international partner operations and the strategies around that. So this segment really is about that global strategy and CPD plans of the program in India. Phil, over to you, sir. Yeah,
thanks very much, Steph, and thank you, Lizzie, for that very passionate presentation you just gave. It's always good to hear people being passionate about what they do. So yeah, as Steph said, I'm Phil Smithers. I'm the Commercial Director here at RCNi, and I've been in the health information business for more years than I wish to recall, but it's certainly between 15 and 20 years. And I too am very excited to be part of this launch here today. So I recall, just looking back, I recall being in India over 12 months ago. It seems only like a few weeks ago, but as we all know, a lot's happened in the last year as part of the launch of IPC. And I had the pleasure in visiting several hospitals and nursing schools while I was there. And thank you very much for everyone who participated in that. And I was really impressed by the commitment and professionalism of all the nurses I actually met, and I did meet a few, but also, and this is quite interesting, for their desire to develop their careers via learning, which is what we're about today, but it's also what we see in the UK. And I think over the last year with the pandemic, we've seen nurses have been at the forefront of everything that's going on. But what we're seeing in the UK is that the whole profile of nursing has actually evolved and developed, and we've got more nurses trying to sign up to nursing schools than we've ever seen before, which is really encouraging. So I'm delighted to be able to speak to you today, and also to share the stage with all our colleagues at IPC Health and other people who are presenting today. So just a quick history lesson. RCN is an independent healthcare information company that is actually wholly owned by the RCN. We are a not-for-profit organisation, meaning that all our profits that we make through our activities are returned to the RCN, and that is used to actually invest in nursing, not only in the UK, but also internationally as well. For those who don't know, the RCN was actually formed over 100 years ago and has been supporting nurses and promoting the vital importance of nursing staff, especially relevant as we face the challenges of this global pandemic. The RCN began as a college nursing in 1916 with only 34 members. And since then, the whole RCN group has evolved into the largest professional organisation and union for nursing staff in the whole world. And currently we've got more than 450,000 members. The RCNi was formed in 1987. And effectively, we are the commercial arm of the Royal College of Nursing. We are the premier provider of innovative and creative information solutions for the whole nursing team and associated health professionals. Our mission is quite straightforward. We want to inspire, develop, and connect the nursing community to deliver the best possible customer care and patient care. And currently, to do this, we produce 11 journals that some of you may well be aware of, to provide health professionals with the latest developments impacting nursing globally, including the changes in policy practice and research. We also offer a range of digital products, including the RCNi Learning product, which we'll be talking about in more detail later. In order to actually develop and grow our business, we partner with organisations who are committed to our vision of improving the health of patients and the public. And this is why I'm very pleased to be sharing the stage with Impelsys today. All our products have been designed, written and developed by nurses for nurses. And unlike a number of other organisations out there, this has actually been done in the UK. And a lot of the work most of the work we've done is predominantly done in the UK. But as Samir and Steph has mentioned earlier on, we are now on a journey to actually roll out on an international basis. And one of the key RCNi's strategic aims as a company, and one that I am leading, is our international expansion. 3 years ago, we undertook some very detailed research to identify which international markets would be the most appropriate for our products and services. And the findings of this research informed us that India, alongside Southeast Asia, Australia, New Zealand, Canada, and Northern Europe will be the best fit for our products. Initially, we made our journal content available to international nursing schools and hospitals, and now it's the time to increase our international activity by making our digital products, especially the RCNi Learning, available to international nurses in our chosen markets. Now, RCNi Learning is an interactive online resource of CPD training modules. And as I said earlier, our strategy is to work with international partners who share our values and mission of improving the health of patients and the public. As Samir said earlier on, RCNi and Impelsys have a long established partnership connected by a joint vision and values. So it makes perfect sense for us to collaborate and jointly invest to provide a unique offering for the Indian nurses. As Steph said, I personally have a very strong working relationship with Samir and the Impelsys team for over 10 years now. And I can honestly say that the relationship and collaboration works well together, and it has been built on trust. We've worked through some challenges in the past, and I think that's where you actually build up the relationship, when you work on challenges together and come to a good outcome. So 18 months ago, both companies made a strategic decision to jointly invest and collaborate in adapting a selection of our learning modules, specifically to meet the needs of the Indian nursing market. Samir showed a photograph earlier on, which I wasn't in the photograph because I was the one actually taking the photograph, but that's where it all kicked off. But this is just the start of our program. We at RCNi, and in collaboration with our partners, are continually improving, adapting, and adding to our range of products to help guide the nursing professionals through their studies and their continual professional development, known as CPD. And as Lizzie quite rightly said earlier on, CPD accreditation is really important for nurses in the UK, and it appears that CPD accreditation is becoming important in the Indian market as well. Anyway, alongside Impelsys, RCNi wants to help you to develop your careers and to help you deliver outstanding patient care. We aim to inform and inspire nurses at every stage of your careers, and now with over 30 years at the forefront of nurse education and CPD, and as part of the Royal College of Nursing Group, we are the most trusted provider of expert nursing information brought to you via the IPC platform here in India. And as I said, this is just the beginning. And I think Deepak has said it and Samir has said it as well. This is the beginning of the journey. And now we want to work in partnership with all of you and the nursing community here in India. We will be proactively seeking your feedback, views and ideas on how we can develop our content via the IPC platform to not only meet your needs now, but also into the future. We want to know how we can develop this product further to actually meet your needs. And both Impelsys and RCNi are fully committed to the ongoing development of this program. And I personally look forward to meeting some of you face to face when we're allowed to travel again to get firsthand your views and suggestions. The learning modules, as part of the RCNi Learning, have helped nurses and nursing students to bridge the gap between theory and practice, and are all evidence-based and fully peer-reviewed. And we'll talk more about that later. The RCNi Learning modules, and what we have seen in the UK, are fully interactive with features and functionalities that engage the user and facilitate high learning experiences. They are fully optimized for use on mobile phones. And as Lizzie was saying, that is the way people want to learn now, is on their mobile devices. But underpinning everything is that all the modules have been fully accredited by the Royal College of Nursing. So in summary, I'd just like to say personally, this is very important to me. I come from a family of nurses. Both my mother and my sister were both career nurses, and I'm passionate about helping nurses develop their careers and overall improving patient care. This is the start of our work together in India, and I look forward to being actively involved as we move forward. So I know we've got the opportunity for some questions later, but I'd now like to hand over to my colleague, Dr. Richard Hatchett, who was our senior nurse editor, and he has been instrumental in the development of this product, and he's going to share some of our experiences here in the UK. Thank you very much.
Thank you, Phil. I've learned more about you this morning than I have in 3 years. Didn't know your mother and sister were nurses, so that's good. That's good to know. Thank you, everybody, for asking me to speak today. I hope everybody's safe and well. It's very challenging times, as Sister Lizzie was saying there. Okay, what I've been asked to do, well, let me just introduce myself. I'm the senior nurse editor for RCNi, and I'm a registered nurse. My background is cardiac and intensive care nursing. And my primary role with RCNi is overseeing the quality of the content that we produce, ensuring that for our nursing colleagues, it's up to date, it's peer reviewed. As Phil was saying, it's accessible, both technologically and also that it's relevant and peer reviewed. So it really does make a difference to patient care and to your practice. Now, the question I've been asked to discuss today is how has RCNi Learning helped nurses in their career progression? So the way I'm going to do that is to look at what nurses want from education platforms and from education resources to progress their career. And I'll talk a little bit when we get to that slide as to how we gain that information. And then quite simply, I'll focus on what RCNi Learning does to achieve that goal. Now, in this slide, this essentially sums up a little bit of what Phil was talking about when he talked about connect, inspire, and develop. And I wanted to show you this slide because it demonstrates the dynamic nature of RCNi. As Phil was saying, we're part of the Royal College of Nursing and have been for over 30 years. So primarily all that we do is ensure that we are producing brilliant and excellent educational resources in a changing world for nurses. That's what we do. And these are the many ways that we achieve that. And we connect, inspire, and develop. And I'll just quickly summarize what that means, because I think it's the thread that goes through the partnership working and goes through the product itself. When we talk about connect, it's important we connect with nurses through the products, that they see it as relevant, that they see it as up to date, that they see it as peer reviewed, and that they really feel that it will change their practice with their patients and will enhance their professional development. Without that connection, people will go elsewhere. They won't feel that it's relevant to them. So that's primarily what we do there. We connect. Inspiring, what that means to us in this product is we don't want learning ever to be overpowering, to be frightening, to be unnerving. We want people to feel that they've got something out of the learning, that it's inspired them to change their practice, to meet their patients' needs, and to go on and learn even more. So inspiration in learning is critically important. And develop, and Sister Lizzie touched on this with her slide from Nightingale, development is about lifelong learning, that learning doesn't start and stop with our modules. And you'll see within the structure of them that, for example, they have detailed reference lists, they have exercises to allow you to reflect, to think about your learning and to think, well, where do I go from here? What do I need to do now? And also we provide links so that you can look at other resources as well. So the whole philosophy there is that learning is lifelong, is professional development. So you'll see there on that slide, right at the bottom there, workforce learning and development and RCNi Learning. Don't worry about the portfolio. That's a product we developed for the UK market, because over here we have to revalidate, which means we have to do specific exercises, as other countries do, to stay on the NMC register. So the portfolio goes there, but we're talking particularly about RCNi Learning here. Can I have the next slide, Steph? Thank you. So what do nurses progressing in their careers do? Well, we connect with the Royal College of Nursing, as we say, and Phil was talking about that. So we not only connect with their senior management and over 2/3 of the nurses registered in the UK are part of the Royal College of Nursing. It's their professional organisation and their union. So we have that connection, but also they have over 44 specialist forums, respiratory, cardiac, long-term conditions, mental health and so forth. So there is a huge pool of resources that we are part of who are constantly working with us on our resources. So we get a good idea of what nurses want as they progress in their career. Also, we have analytics, very detailed analytics, so we know what people are looking for, what they access, what they want. And also, we do periodic focus groups and research, so we get constant feedback as to what our nursing colleagues are looking for to progress their careers. And what they want is up-to-date, evidence-based and reliable resources relevant to practice. That's quite a mouthful, but those phrases in there really drive what we do. It has to be up to date. It has to be evidence-based as much as you can demonstrate that. We all know as nurses that evidence can be variable within our practice, but as much as we can evidence-based, reliable resources. And what we mean by that is not only reliable technologically, as Phil was saying, across the platforms, the phones, and Sister Lissy was touching on this, phones and tablets and computers, access 24/7, but it has to be reliable in that we know that it is peer reviewed, it's up to date, it's going to be relevant to your practice. Clinical as well as professional practice support. So of course, as nurses, we want our clinical material to know that what we're doing clinically is up to date, but also nursing is so much more than that. So I'm thinking here in professional practice about leadership, about supporting students, about equality and diversity, about organizational culture, the things that glue us together as a profession. Accessible 24/7, the ability to reflect on practice. That's so important in education, that you can think about what you're actually learning. You can think about how that affects your practice, what you may need to develop further on. So you'll see within that the pre-tests, the timeout activities, all sorts of different online resources and interactive activities is what I'm saying, that allow you to reflect on your practice. So it becomes very focused on you as you actually use the material. The ability to test knowledge and have further direction. So again, that links to reflection, the ability to say, well, how much have I learned here? What more do I need to do? Or actually, I've learned a lot here, maybe I need to move on to something else. And to have further direction, as we've said, and that links to lifelong learning and professional development. So with the RCNi, I've mentioned that we have over 30 years experience. That's said really. So we constantly work and have done since the 1980s with the nursing workforce. We do this also by meeting the changing way that nurses access education. Phil has touched on this, Sister Lissy's touched on this. We are very much moving away from a print world where people are reading journals. They want material that's accessible 24/7, that is available on a variety of platforms. So we very much meet the changing way that nurses access education. Bite-sized learning is very important. Now, when you look at our modules, they're quite big, but they're structured in a way that allows you, if you wish to use them in a bite-sized format. You've got down the side the navigation bar. You could just do the pre-test, have a think about things for a few weeks if you wanted, and come back. Each section has learning points at the end of them. So you could do a whole module, or you can dip in and dip out, and that meets the changing way that nurses access education in a very busy and challenging world. And we've certainly known that in the last year. By offering interactive learning and reflection, it really does focus on what you want out of the education. You're very much in the driving seat. Next slide, Steph. Okay, so RCNi Learning is relevant to practice because we double blind peer, or one of the reasons is we double blind peer review. Many of you know what that means, but I'll just summarize that. That means that all of our modules are written by experts in the practice area. That's primarily in practice, it can be in the academic world. And then it's double blind peer reviewed, which means that it goes to another expert in that area to review, who doesn't know who the author is, and the author doesn't know who the reviewer is. And the advantage of that is everybody focuses on the work itself and what this is aiming to achieve, rather than on the person who's written it. So double-blind peer review is a standard within education, the publishing world, and very much we adhere to that. So everything that you see will at least be seen by 2 reviewers and very often more. Phil talked about our modules being RCN accredited. That's another layer that we put in as well. So we do have a very extensive review process. And we're offering learners ongoing professional development. And I've touched on that, but it's lifelong learning. And just finally there, we never assume that we never assume that the user knows everything. What I mean by that is everybody watching today will have different levels of knowledge. I will, Phil will, Sister Lissy, and everybody in the audience today. So we never assume that you know everything. So what I mean by that is we provide a glossary, we explain terms. So if you don't know what transactional leadership is, or Prader-Willi syndrome, or organizational culture, it will be explained. Excuse me, it will be explained. And that's critically important because we don't want to lose anybody. We want to take everybody through our learning. And if you already know what things are, you can move on. But we never assume the user knows everything. So you'll see that everything is explained to you so that you don't have to keep looking it up elsewhere. So the key to our work very much is that we're looking at work that is relevant, it's evidence-based, it's reliable, it's up-to-date, and it's accessible both technologically and that there is a connection there. So that is our aim, really, to connect with you, to inspire with you, and to inspire you and to develop. Thank you very much.
Thanks very much.
Thanks, Dan.
Yeah, thanks very much, Richard. Again, fantastic salient points. So I think it's great stuff so far, and really moving well into this webinar. So we will have time for questions and answers, of course. So we've had quite a few coming in. So thanks for sharing, and keep sharing. We'll get to those. Richard, I think it'd be really good actually if we could just perhaps play a testimonial too. I think we have time for that. So I hand over to you for that part, please.
Hello everyone, I'm Doresh. I'm basically a registered nurse having a 9 years experience in this field. Presently I'm working as a nursing educator in Claymedy Healthcare. So I have been going through these RCNi modules with IPC Healthcare. So those are very informative for nurses to learn and improve their skills and their career. I can truly recommend them to all nurses, especially the new nurses coming to the profession, to aspire knowledge through these fabulous modules. So you can buy them through the app, and you can read and improve your skills. They're very informative, and I assure that they'll definitely help you to improve your skills and to improve your career as well. So thank you very much.
Hi everyone, I am Beatrice, nurse educator in Ramaya Memorial Hospital. On behalf of Ramaya Memorial Hospital, I take this opportunity to talk few words about RCNi online learning module. It is an accredited, reputed organization, and the modules are prepared by qualified personnel and professional experts. RCNi courses are certified course, and it is exclusively dedicated for staff nurses. It is one way of training the staff through e-learning services where the staff can able to uplift their professional knowledge in service without quitting their job. It also helps new nurses or freshers to bridge the gap between theory and practice. All the contents are evidence-based and peer-reviewed by professional experts in nursing to ensure that it promotes best practices and care of patients. As we all know, nursing profession is a dynamic process. As the contents in the modules are reviewed and revised periodically, it will help the nurses to stay up to date. I also encourage my staff nurses to take this course and utilize it effectively. Being a nursing fraternity, I would suggest that you can also support your staffs by taking this course for their professional development. Thank you.
Thanks so much, Risha, to play those testimonials. I think it's always nice when we see those people on the ground give their exact viewpoints, you know, and you know what it's actually like on the engagement of the actual product life cycle, career progression, and so on. So I think it's always really nice to hear that from people on the ground. So I think actually now we've come to this part of the session really where we can open up to question and answers session really, and we've got our panel here, so I'll kind of moderate that. So let me just look. I've got quite a few coming in, so bear with me. I think for the first one then, let's have a look. So what is the format of the CPD program? Is it instructor-led, or do you learn that at your own pace? It's a good question, actually. Probably, I think, Deepak, you might want to just give a quick answer on that one.
Yeah, so I think the advantage in, can you hear me?
Yes.
Yeah, so it's self-paced, which lets our nursing colleagues really fit that into their own time and their own work schedule, and you know, based on travel, because it's mobile friendly, they can take this on any time. So it's essentially a self-paced, self-directed learning tool.
Thanks, Deepak. I think that generally just tells you how easy it is to use as a tool online, offline, and everywhere. And that's the whole point regarding nursing. You know, the schedules are really busy and it's really stressful. And we've all seen that, of course, even with all the pandemic stuff that's ongoing. So that's really key and important, that sort of self-paced learning. So I think another question we've got is, how will this program help in your personal professional development? Could we give some examples from experience in the UK? I guess, Phil, that could be quite nice for you to look at that one. So this is really on how the program will help in, you know, their own professional development. What examples have we got?
Yeah, that's probably good. Actually, far be it for me to pass the buck, but if Richard's still there, he might be able to answer this better than me with some more. And I know he's smiling because I'm sure he'll get me back later. But
yeah. I suppose there's two parts to that. And colleagues were just asking about working at your own pace, as Deepak said. Yes, absolutely. As I was saying in my presentation, work at your own pace. You take control. It allows you to do that. You've got your menu. You can pick and stop where you want. Interestingly, when you come back into the program, it will ask you, do you want to start where you are? Do you want to go back to the beginning? So it's a very flexible program. We've worked with a lot of organizations to develop. I was thinking, actually, Phil, are we allowed to mention companies? I was thinking Salts Healthcare is a very good example of a group of specialist nurses very recently who we worked with in Birmingham, which is north of London. They have about 450 nurses who work with stoma patients and colostomy care, and they very much found our products very useful because they're extremely busy nurses. And of course, you can imagine at the moment with the pandemic, not being able to access patients, etc., but also working from home a great deal. So they found not being able to come, they've got a big office in Birmingham where they've not been able to come into. So being able to use the learning platform whenever and wherever they want to. They've also found using it between patients on their phones, I'm joking apart, but literally in the car park between patients, etc. They can drop in and do 10 minutes of learning, etc. So the flexibility is there. They're a very good example of a company, I think, Phil, that we've worked with that I think are probably one that has a large number of nurses, very much on the ground, practical nurses.
Thanks, Richard. That's a good answer. So actually, nice question from a member in the audience. Congratulations, all of you. Just wanted to ask if there are specific modules meant for psychiatric nurses as they deal with a different subset of patients altogether. Thinking about our content and all that put together, maybe Renu, Dr. Renu, do you have a view on that? Dr. Renu. I think we asked the question once, but we got 4 answers. So I'm sorry about that feedback. Dr. Renu, can you hear us?
Yeah.
Oh, perfect. So yeah, that question was really about specific modules for psychiatric nurses. I know you've been in the heart of the content with the RCNi in this, but I just thought might be an idea on this one if you have an idea on that one, really, about the different subset of patients altogether, or how they're treated in that respect in the learning?
Yeah, sure, Steph. So we do have courses on psychological nursing. Like we have courses like meeting the psychological needs of patients with cancer, priorities at end-of-life care, caring for people who are dying, cultivate compassionate care for patients. So these kind of modules are part of our RCNi program. And as we keep on adding new courses every month, you'll get to see more cases related to psychiatric nursing. Yeah,
Thanks,
I hope
Dr.
that
Renu.
answers the question.
Yeah, no, I think that does. And I mean, I'm thinking about, while we've got you there, Dr. And there's another question I think could be suited for you as well, looking at this one. How will you ensure the skill enhancement through the online platform? Any new strategy, or, that's...
Yeah, this is a good question. See, RCNi program is offering peer-reviewed and evidence-based content from academicians, and we are getting best practices from the world through these modules or through this program. And this is to complement what nurses are doing in their daily practice. Say, for instance, a module on COTI. COTI is something that healthcare professionals deal every day in their daily practice. But this is something where they'll offer you best practices from outside India on what is the right way, or what are the guidelines for taking care of patients with catheter associated UTI. Then there are other contemporary topics like end of life care, meeting psychological needs, where some nurses have actually to start learning. They need to learn before they start practicing, because it's something which are new, and these topics have evolved because of the need of patient-centric care, because the focus has now moved to patient-centric care. Then regarding the strategy, any strategy we do have a strategy. We will provide support and advice to nurse educators in our hospital network to actually take up these courses for classroom teaching. So these courses can be taught in the classroom in the regular teachings that happen in the hospitals.
Thanks, Dr. Renu. I mean, just thinking, is there another question here? It's kind of related to content. I'm just thinking of you. Is there any specific for pediatric at all?
Yeah.
There's another question from the audience.
Yeah, again, we do have modules on pediatrics, and we have resuscitation equipments, educating nurses to communicate bad news, and we have courses on lactation. And as we will add more courses, there'll be some or the other subset would relate to pediatrics.
Okay, thank you. Let's have a look. We've got some more questions, so we've got a bit of time left. Okay, will there be an assessment on completing the 30 courses, which we're launched with, to get the CPD completion certificate? So I'm thinking, Richard, maybe, how do you feel about this? So this question really on the assessment on completing 30 courses to get a CPD completion certificate. What would be the...
Well, of course, as Dr. Renu said, the 30 is just our launch, so they'll be going on and on. So 30 is a useful number for us to launch with, as Dr. Renu was saying, a nice collection of different modules there. So you won't get one at the end of 30, but you can print off a certificate at the end of each module. Because again, we could say, should you print off at the end of 25 or should you print off at the end of 35? It's an arbitrary number. It's a great launch number to show our nursing colleagues out there the range of things. And as Dr. Renu says, we'll add to that. So don't worry too much about the figure of 30. I think it's about thinking about your own professional development and printing off certificates relevant to what you need, whether that's 2 modules, 10 modules, 30 modules, or beyond. So it's not really structured around a course of 30 modules. That, as Dr. Renu said, it will be ongoing. It's professional development. So I think once colleagues get in there and see, they'll be able to see that they can mold that to what they want. Actually, they can do the tests and print off a certificate for 1 or more modules, depending on what they need. So I wouldn't get too hung up on the 30 figure. It's very much about what users need and want, and the fact that the platform is very flexible to provide that.
Oh, great answer. Yeah, I mean, that's a really key point, adaptable and flexible. So, I mean, as these needs changes, as new content will be updated onto that platform. Absolutely. And I think that's really important for the learning journey, and cater also for other groups. So, yeah, something we'll work together with, RCNi, PC Health and Pelsis on that strategy. Okay, so, I mean, Deepak, maybe one for you here. How will the CPD program give me an advantage over my peers? What is new or different about this program? Again, interesting question from an individual's point of view. It's good,
Yeah, and I think this kind of refers back to a few things we talked about. There's obviously the career avenues are opening up. We've recognized that we are desperately short of medical professionals, doctors, etc. So already there being steps being taken to open up other pathways like nursing practitioner, and as the healthcare sector expands with the new focus by the government, I think we've met lots of nurses who aspire to take on leadership roles, need to develop a broader view to be able to really progress in their career within their own hospitals. So some of these CPD programs are completely unique in the sense they've never been available in the market, and all of these will address those 4-5 areas. They'll broaden and deepen their clinical skills. They will teach them soft skills, which are patient facing, but also soft skills for managing yourself and managing your own professional growth. So a lot of these are literally tied back to what I said about the evolving nursing scenario. I think this is just a very beginning. Dr. Sister Lizzie shared the recent advancements that the government has made about opening up different avenues of growth, the CNE modules. So this is a big advantage to anybody who's gone through these courses, because they're right in touch with what's the best practices worldwide in those areas, and also unlike a very narrow path where you get into a specialty. If you're in an early stage of your career, you want to explore, or you've reached a certain career stage and you want to broaden your overall view of healthcare management and aspire for a leadership role, all of these fit in very nicely to your aspirations.
That's actually really, I appreciate that answer, because it's very detailed and it will give a lot of information to that person who asks a question, and lots of thinking around that. Actually leads to another one, Deepak. We have time for 2 more questions. Another question here. Are all courses mandatory to get a certificate? So I think you might have answered it somewhere along in that question, but it's a separate question.
So as I mentioned, this is going to be an ongoing body. It's like Netflix, right? So the certificate is part of it. I think we should also address that. I think that we've structured for now at 30, but really it could be, to start, it could be any 30. And literally as we go through the year, we just keep adding more and more content, every month. So it's nothing specifically mandatory. I think the way we've designed it to have a critical mass so for the participants to get value out of this, and we'll look at feedback on if participants feel certain things could be mandatory. But for now, I think what as Richard said, this is a number which we felt would be give a little the right sort of critical mass to your corpus of learning, be able to justify the certification. But there's no one specific or a set of prerequisites courses which you design on.
That's I think what Richard said earlier, that flexibility is really key, because each, knowing the experience I've had in the UK working with, alongside RCNi, and this is really important in that aspect. So yeah, I think we've got time for one more question. Let me see. So are there any contact hours? I think this means like hands-on training requirements with the program. So maybe Richard, seeing as you're kind of on the ground there, whether that's a question you'd like to take up. So this is about, are there any contact hours, the hands-on training aspect requirements with this program?
Was that me, Steph? Sorry, you broke up.
Yes, so Richard. So this is to do with like hands-on training requirements with the program, or is this actually that self-paced learning, like you said earlier? I think it's more,
Yeah, absolutely. No, there isn't. But it depends how you use it, as Deepak was saying. It depends how you use it. What we hope that these modules will be embedded within organizations. So one hopes, we've had Sister Lizzie this morning, that organizations will use this as a core part of their training in the classroom, in practice. So from our point of view, we provide with Impulsus the education, but we hope that the organizations will use this as a central core to a bigger picture. So there's no requirement unless the individual organization says, look, we want you to do this module, and we want you to undertake particular hours within the practice areas. So there's no mandatory from our point of view, but I don't want to cut off and say that it wouldn't be good within organizations, obviously, to close the practice theory gap by embedding it within a bigger education provision within organizations.
Thanks, Richard. Again, really great answer. So I feel, there are a lot of questions in the audience, but we do have to, I think, come to an end in this session. But look, I just want to say, look, thanks for all of you for attending the webinar. And I hope, you not only found this highly engaging and informative, but also to the audience out there, that it gives you a way forwards, an inspiration in your next steps to progress your careers and so on. So I really would like to take special thanks to our guest speakers who've taken, they obviously love to come on this webinar, so it was it's great to have them here. So thanks to Phil Smithers, Richard Hatchett, Sister Lizzie, Deepak Sharma, and of course Mr. Samir Sharif. And finally, do share your feedback of the event, and please look out for our next webinar event we are planning with RCNi. It's going to be a series we're doing here with different speakers, and continue this engaging discussion, because as some of our panelists have said, it's a lifelong and changing, flexible, adaptable. This is what we have to be in nursing. So we have to make this also webinar series engaging. We'll take your comments, any feedbacks. We'd be very welcome on that. So Samir, I think is anything or Risha, is anything you want to add there, or perhaps you want to play another video? I'm not sure. Have we got time for that?
Yes, Steph, we would like to play, we would like to end the session with our IPC Health video. I'll just...
I want to just say thanks to Phil, Richard, Sister Lizzie, and Deepak, and we're looking forward to a great partnership and really supporting all the Indian nurses over the years to come. Go ahead, Richard. Thank you very much.